A noticeable change in vaginal odor can cause concern and anxiety for many women, but it's important to recognize that every vagina has a natural, unique scent, which varies based on factors like your menstrual cycle, diet, lifestyle, and hormonal balance. While some level of odor is normal, particularly after exercise or a long day, strong or unusual vaginal smells might indicate an underlying issue that needs attention. In this comprehensive guide, we'll explore everything you need to know about vaginal odor: what's normal, what's not, potential causes, and the steps you can take to keep your vagina healthy and odor-free. From dietary habits to personal hygiene, this guide covers both the everyday maintenance and more serious signs that might require medical intervention. The basics. What causes vaginal odor? The vagina is home to a delicate ecosystem of bacteria, much like the gut. This microbial balance is essential for vaginal health, and it plays a key role in determining your vagina's natural scent. However, a strong or unusual odor can be caused by a variety of factors. Some of these causes are harmless, while others may indicate an infection or imbalance that requires treatment. Here are the primary factors that can influence vaginal odor. Sweating and poor hygiene. The vulva, which is the external part of the vagina, is surrounded by sweat glands, and like other parts of the body, it can accumulate sweat, especially during hot weather or physical activity. Sweat mixed with bacteria can lead to a musty or sour smell. It's important to clean this area regularly with mild, unscented soap and warm water. Bacterial vaginosis, or BV, is a common vaginal infection caused by an overgrowth of harmful bacteria, upsetting the natural balance of the vaginal flora. It often results in a fishy odor, which may become stronger after sexual intercourse. BV is typically accompanied by thin, grayish discharge. While BV isn't necessarily dangerous, it should be treated promptly with antibiotics, as untreated BV can lead to complications, including an increased risk of STIs and pregnancy complications. A yeast infection occurs when there is an overgrowth of the fungus Candida. While yeast infections do not typically cause a strong odor, they can lead to a subtle, musty smell. Other symptoms include thick, white discharge that resembles cottage cheese, itching, and irritation. Yeast infections can be treated with over-the-counter antifungal medications, though severe or recurrent cases may require prescription treatment. Trichomoniasis is a sexually transmitted infection caused by a parasite. One of its most noticeable symptoms is a strong, foul-smelling discharge, often yellow or greenish in color. Trichomoniasis is highly treatable with antibiotics, but it's important to seek medical attention to avoid complications. Hormones play a significant role in vaginal health, and fluctuations in estrogen and progesterone levels during menstruation, pregnancy, menopause, or while using hormonal contraception can affect vaginal odor. During menstruation, for example, you may notice a stronger metallic smell due to the presence of blood. Similarly, the hormonal changes during pregnancy can cause changes in vaginal discharge and odor. Dietary factors can play a significant role in influencing vaginal odor. Certain foods such as garlic, onions, spicy foods, red meat, and coffee might lead to temporary changes in how your body smells, including the vaginal area. On the flip side, incorporating foods rich in probiotics like yogurt and fermented foods can promote a healthy vaginal environment and reduce the likelihood of infection-related odors. Poor hygiene and underwear choices can also impact vaginal odor. Wearing tight, non-breathable fabrics, such as synthetic materials, can trap sweat and moisture, contributing to unwanted odors. It's best to opt for cotton underwear, which is breathable and helps wick away moisture, keeping the vaginal area dry. Additionally, changing your underwear daily and after sweating can help maintain freshness. Sexual activity can sometimes lead to a temporary change in vaginal odor. This may happen due to the mixing of bodily fluids or semen, which can alter the vaginal pH. Using condoms, maintaining proper hygiene before and after sexual activity, and ensuring that both partners are clean can help minimize this issue. Not changing tampons, pads, or menstrual cups frequently enough can lead to the development of a bad smell, as blood and moisture create a favorable environment for bacteria to thrive. Menstrual hygiene is crucial to prevent not only odor, but also more serious conditions like toxic shock syndrome, which can occur when tampons are left in for too long. Some variation in vaginal odor is normal, but there are times when an unusual smell could signal a problem. Here's when to be concerned. A persistent, strong odor that doesn't go away after washing. A fishy smell, especially if it becomes more noticeable after sex. Yellow, green, or gray discharge with an unusual smell. Itching, burning, or irritation along with the odor. Pain during urination or sex, which can be signs of an infection. If you experience any of these symptoms, it's important to see a healthcare professional for evaluation. Vaginal infections like bacterial vaginosis, yeast infections, and STIs are treatable, but they need to be properly diagnosed. Maintaining proper vaginal hygiene is the best way to keep your vagina clean, healthy, and odor-free. However, over-cleaning or using harsh products can actually harm the vaginal environment. Here are some key tips for maintaining vaginal hygiene. Avoid douching. Douching disrupts the natural balance of bacteria in the vagina and can lead to infections such as bacterial vaginosis. The vagina is self-cleaning, and using harsh chemicals or scented products can do more harm than good. Stick to gentle cleaning with warm water and mild unscented soap for the vulva, which is the external part of the vagina. Wipe correctly. Always wipe from front to back after using the bathroom to prevent bacteria from the anus from entering the vaginal area, which can lead to infections. Wear breathable fabrics. Choose cotton underwear to allow airflow and reduce moisture buildup. Avoid tight-fitting clothing and non-breathable fabrics that can trap sweat and promote bacterial growth. Also, consider sleeping without underwear at night to give your body time to breathe. 4. Change menstrual products regularly. Whether you use tampons, pads, or menstrual cups, be sure to change them regularly during your period. Tampons should generally be changed every 4 to 8 hours to avoid the risk of toxic shock syndrome, or TSS. And pads or liners should be changed frequently to prevent bacterial growth. 5. Stay hydrated. Drinking plenty of water helps flush toxins out of the body, which can reduce odors. It also keeps your skin and tissues hydrated, promoting overall vaginal health. 6. Maintain a healthy diet. What you eat has a direct impact on your vaginal health. Incorporate foods that support a healthy microbiome, such as yogurt, kefir, and other probiotic-rich foods. Limit sugary and processed foods, as these can contribute to yeast overgrowth and infections. Practice safe sex. Use condoms to reduce the risk of STIs, which can cause unusual odors and other symptoms. And be sure to clean the vaginal area after sex to remove any bodily fluids or bacteria that may contribute to odor. Avoid scented products. Scented tampons, pads, vaginal sprays, or powders can irritate the sensitive skin of the vagina and disrupt the natural pH balance. Stick to fragrance-free products to reduce the risk of irritation and infection. Probiotics and vaginal health. Probiotics are beneficial bacteria that can help maintain the balance of the vaginal microbiome. Studies suggest that consuming probiotic-rich foods like yogurt, kefir, sauerkraut, and kimchi, or taking probiotic supplements, may reduce the risk of infections such as bacterial vaginosis and yeast infections, both of which can cause odor. How probiotics help. They restore the balance of healthy bacteria in the vagina. They help maintain the vagina's natural acidic pH, which prevents the overgrowth of harmful bacteria. They may reduce the likelihood of recurring infections. When should you see a doctor? While mild vaginal odor is usually not a cause for concern, certain symptoms warrant medical attention. You should consult a doctor if you experience a foul or fishy odor that persists for several days. Unusual discharge, especially if it's yellow, green, gray, or frothy. Pain or burning during urination or sex. Itching, redness, or swelling around the vaginal area. Fever or other systemic symptoms that may suggest a more serious infection. Your healthcare provider may conduct a physical examination, take a sample of vaginal discharge for testing, or perform other tests to diagnose the underlying cause. Most vaginal infections are easily treated with antibiotics or antifungal medications, but it's important to get the right diagnosis to ensure proper treatment. Long-term care for vaginal health requires a combination of good hygiene, healthy lifestyle habits, and regular medical checkups. Here are some tips for long-term care. Make sure to have regular gynecological exams, even if you don't have any symptoms. Routine checkups can help catch infections or other issues early, and your doctor can provide advice tailored to your individual needs. Limiting the number of sexual partners and practicing safe sex with the use of condoms can significantly reduce your risk of STIs, which are a common cause of vaginal odor and discomfort. As you age or go through hormonal changes such as menopause, your body's estrogen levels can affect the health of your vagina. Talk to your doctor about how hormonal changes might impact vaginal health and discuss options such as hormone replacement therapy if needed. Healthy lifestyle choices. Keeping your immune system strong is crucial for vaginal health. A balanced diet, regular exercise, good sleep, and stress management can all help your body maintain a healthy balance of bacteria in the vagina. Listen to your body. You know your body better than anyone else. If something doesn't feel right, whether it's a new odor, unusual discharge, or discomfort, don't hesitate to seek medical advice. Being proactive about your health is the best way to prevent small issues from becoming bigger problems. Vaginal health and mental well-being. It's not uncommon for women to feel embarrassed or self-conscious about vaginal odor, even when it's entirely normal. Unfortunately, this stigma can sometimes prevent women from seeking help or discussing their concerns with a healthcare provider. It's important to remember that vaginal odor, like all aspects of health, is a normal part of being human. If you find yourself feeling anxious or embarrassed about vaginal odor, try to remember that it's a natural part of your body's function. Education and open conversation about vaginal health are key to reducing the stigma and ensuring that women feel empowered to take care of themselves. In summary, a slight vaginal odor is normal and nothing to worry about. However, if the odor becomes strong, unpleasant, or persistent, it's important to pay attention to your body's signals. Most causes of vaginal odor, such as bacterial vaginosis, yeast infections, or trichomoniasis, are easily treatable with the right medical care. By practicing good hygiene, maintaining a healthy diet, and being mindful of your body's changes, vagina healthy and odor-free. Remember that it's important to seek medical advice if you experience any unusual symptoms, and don't be afraid to talk openly about your concerns with your healthcare provider. Your vaginal health is an essential part of your overall well-being, and understanding how to care for it can help you feel more confident and comfortable in your body. Whether through dietary changes, better hygiene practices, or medical intervention, there are many ways to address vaginal odor and keep your body healthy. Embrace the knowledge of your own body, and don't hesitate to take steps toward ensuring long-term vaginal health and wellness.